Hello students, today we will discuss about the anatomy of ulnar nerve. Now when you will see the anatomy of ulnar nerve, we will discuss it under following headings: introduction, root value, formation of ulnar nerve, course and relations of ulnar nerve in the different part of the upper limb, its branches and some important applied anatomy of ulnar nerve. Now, when you will see the ulnar nerve, it is having a very long course. It starts from higher in the axilla and it terminates into the proximal part of the wrist joint where it will divide into its terminal branches. So, when you will see the ulnar nerve, you know that ulnar nerve is a branch of medial cord of brachial plexus. Now, when you will see the brachial plexus, it is having the three cord: lateral cord, medial cord and posterior cord. So, it comes from the medial cord and it passes through the arm, then it enters into the forearm and ultimately enter into the hand, where it innervate all the your short muscles of the hand, which are known as intrinsic muscles of the hand, except few of them like three thenar muscle and two lumbricals. Now, these five muscles supplied by the median nerve, and in my class of the median nerve, we have already discussed how the median nerve supply these five muscles, or you can say the short muscles of your hand. When you will see the ulnar nerve is also known as musician nerve. Why musician nerve? Because it controls the fine movements of your fingers, and you as you know that most of your intrinsic muscles or the short muscles of the hand are going to supplied by ulnar nerve. That's why the major control of your fine movements of the finger is by the ulnar nerve. So, that's why it is known as musician nerve, as it supply muscles controlling the fine movements of the finger. Now, what is the root value of ulnar nerve? Now, root value of ulnar nerve is C7, C8, T1. Now, my dear students, you have to understand one very important concept here, that ulnar nerve is a branch of medial cord, and medial cord is having the root value of C8 and T1. Now, when you will have the three cord, you have the lateral cord, you have the medial cord, you have the posterior cord. Now, if you will see the formation of these three cord, you will realize that the posterior cord is having all the contributions of the roots of brachial plexus, which starts from C5, C6, C7, C8 and T1. When you will see the formation of the medial cord, you are having the two roots C8 and T1. But when you will have the lateral cord, you have the remaining C5, 6, 7. So, what you are able to understand, that this medial cord is formed by the root value of C8 and T1, and ulnar nerve is a branch of the medial cord. So, it should also have the root value of C8 and T1. So, here the question arises in your exam, that how this C7 is contributing in the root value of ulnar nerve. So, for that you have to understand this thing, that near its origin it often receives a communicating branch. Now, this communicating branch is carrying the fibers of C7 and it comes from lateral root of median nerve. So, in this diagram, if you will see that this is your median nerve and this is your ulnar nerve. Now, this median nerve is having two roots, as you know, medial root of median nerve and lateral root of median nerve. Now, here this is the lateral root of median nerve. From this lateral root, a small communicating branch is arising, and this communicating branch is actually carrying the fibers of C7. Those fibers will later on enter into the ulnar nerve. So, the question is that how the C7 fibers become the part of ulnar nerve, though ulnar nerve is a branch of medial cord. So, the answer is by the help of communicating branch, and this communicating branch comes from lateral root of median nerve, which carries the fiber of C7. Now, when you will see such kind of the diagrams, now you have to identify the C8 and T1 roots. Now, for that, you have to first mark the vertebrae. Now, this is your first rib, and you know that this first rib is having a articulation with a single vertebrae, and this vertebrae is articulating here. So, this is your first thoracic vertebrae T1. Now, there is one very important concept to understand, that below the first thoracic vertebrae, you have the intervertebral foramina, which is giving passage for the first thoracic spinal nerve root. And above this, you are having the C8 spinal nerve root. So, when you are identifying the C8 and T1 root, you have to locate the thoracic vertebra. And which thoracic vertebra? First thoracic vertebra. Above the first thoracic vertebra, this foramina is giving passage for the 8th cervical nerve, and this foramina is giving passage to the branch of first thoracic nerve. Clear? Now, what is the course of the ulnar nerve? So, when you will read the course, we will divide it into the 4 parts: course in the axilla, in the arm, in forearm and hand. Most of the time, you have the questions on the part of ulnar nerve in forearm and hand. So, let us discuss this. Now, first we will see the course of ulnar nerve in axilla. Now, after its formation in the lower part of the axilla, the nerve runs on the medial side of your third part of axillary artery. Now, my dear friends, you have to keep this thing in mind, that we are giving the name to different chords of the brachial plexus on the basis of their relation with the second part of axillary artery. So, when you will have the axillary artery, and this is suppose the second part, this is the third part. So, where is the medial cord? So, medial cord lies medial to this second part. And where is the lateral cord? Lateral cord is lateral to the second part. Now, when you are talking about the ulnar nerve is arising from the medial cord, and this ulnar nerve is remain medially. Clear? While you have the medial root of median nerve and lateral root of median nerve. So, the median nerve formation on the lateral side. So, by this thing you have to understand that ulnar nerve is remain on the medial side of the third part of axillary artery, while median nerve form on the lateral side of third part of axillary artery. So, this ulnar nerve, which is part of the medial cord, is remain on the medial side from its origin. Clear? Now, here it lies between the axillary artery and axillary vein. So, what you will realize, that vein comes more medially to this artery. So, in this diagram, you can appreciate the same relation, that this is your medial cord, this is your ulnar nerve, and this is your artery. So, this artery is on the outer side of the nerve, and this is your vein. So, what is the relation? That the ulnar nerve lies on the inner aspect of the third part of axillary artery, but just lateral to the vein. Clear? So, this is become important thing. Now, here also you can appreciate. Now, sometimes you have this image to identify or label the nerves. So, now here you can see that in this axilla, this is your artery. Now, what is the name of this artery? This is become the axillary artery. Now, you can see one nerve is on the lateral side and one nerve is on the medial side. Now, this medial side nerve is known as ulnar nerve, and this nerve is your median nerve. Clear? Now, the another important thing is that in this diagram you can appreciate that this nerve is going somewhere posteriorly. It is disappearing after this level, because the ulnar nerve will see it disappear in the mid of the arm by going in the posterior compartment. Now, what is the course of the ulnar nerve in arm? Now, when you will see in the arm, it runs on the medial side of your brachial artery. Now, the name of the artery has been changed from the lower border of the teres major, you know that the axillary continue as a brachial artery. So, once you are tracing the ulnar nerve, you have to keep this thing in mind that ulnar nerve remains on medial side of this artery, and in upper part the artery is known as axillary, and here it is known as your brachial artery. So, now ulnar nerve comes on the medial side of the brachial artery and it reach up to the middle of the arm. Now, how will you decide the middle of the arm? For that, we are having a landmark, and that is known as insertion of your coracobrachialis muscle. Now, at the level of the insertion of coracobrachialis muscle, you have the change in your arm like the change in the your features of your humerus bone. At the same level on the lateral side, you have the lowermost insertion of the deltoid muscle. At the same level, we have the piercing of your ulnar nerve into the medial intermuscular septum. So, you have this question in exam that what are the changes taking place in the mid of the arm. So, how will you decide the mid of the arm? For that, you have this landmark, that is the insertion of coracobrachialis. So, at this level of the insertion of coracobrachialis, the ulnar nerve pierces the medial intermuscular septum. Now, this is the very important thing that you know arm is divided into the two compartments by medial and lateral intermuscular septum. Now, this ulnar nerve, which is a part of the anterior compartment of the arm, become the part of posterior compartment of arm. So, this compartment of your upper limb, which is anterior and posterior. Now, ulnar nerve will pass from anterior to posterior compartment by piercing the medial intermuscular septum. At what level it pierces the medial intermuscular septum? Again, the answer is middle of the arm, or you can say at the level of insertion of coracobrachialis. Now, here the nerve is piercing along with a artery, and that artery is known as superior ulnar collateral artery. Superior ulnar collateral artery is going to take part in an anastomosis around the elbow joint. So, when you are reading the course of ulnar nerve in the arm, you will realize that in upper part of the arm it is in the anterior compartment, but in the lower part of the arm the nerve is now present in the posterior compartment, but it is along the medial border of the arm only. Now, it descends downward to reach on the posterior surface of medial epicondyle of humerus. Now, my dear students, this is very commonly asked question in your exam, that what is the bony relation of ulnar nerve. So, the most important bony relation of ulnar nerve is that this is your medial epicondyle. Now, the ulnar nerve lies, there is a groove on the posterior side of medial epicondyle. So, you all have experienced that sometimes if you will have sudden trauma here, or if you have the sudden hit on this posterior point of your medial epicondyle, you have a numbness or a sensation along with the medial border. Now, it happened because that trauma irritates your ulnar nerve, which is on the posterior side of medial epicondyle. So, at this point, sometimes you can roll or palpate the ulnar nerve. In case of the leprosy patient, this ulnar nerve is become thick, and you can very easily palpate the ulnar nerve in the leprosy patient behind the medial epicondyle of humerus. So, this is a very commonly asked question in your exam, that where you can palpate the ulnar nerve, answer is behind the medial epicondyle of humerus. So, most of the major structures, when you are reading, they are passing from arm to forearm by a cubital fossa, which is anterior part of the elbow joint, but the exception is ulnar nerve. So, this is the important thing to understand, that whenever you are reading the structures going from arm to forearm, they are passing from anterior side of the elbow, like brachial artery, like you have the median nerve, but the ulnar nerve is not going anteriorly, it is going from the posterior part of elbow joint, and that is your behind the medial epicondyle. So, the ulnar nerve does not pass through the cubital fossa, instead it passes posterior to the medial epicondyle of the humerus, and ulnar nerve has no major branch in the arm. So, whenever we are talking about the muscles of the arm supplied by, always you have single answer is musculocutaneous nerve. So, ulnar nerve is also not responsible to supply any muscle of your arm. Now, when you will see the course of the ulnar nerve in the forearm, you have to understand that this nerve is known as ulnar nerve because this nerve runs along with the ulnar bone of your forearm. And along this ulnar border of the forearm, you are having a muscle is known as flexor carpi ulnaris. So, you are reading the ulnar nerve, so you have to correlate the ulnar nerve with the muscle which is having the ulnar name like flexor carpi ulnaris. So, it becomes easy to keep in mind that ulnar nerve enters into the forearm by passing between the two heads of flexor carpi ulnaris. Because there are few nerves which pierces or passes between the two heads, like you have the pronator teres, and between the two head of pronator teres, the median nerve enters into the forearm. In the same way, you have the supinator and your posterior interosseous nerve enters in the posterior compartment by piercing the supinator. So, here this question is become important for your exam, that how ulnar nerve enters into the forearm. So, ulnar nerve enters the forearm by passing through a triangular gap between the humeral and ulnar head of flexor carpi ulnaris, and this gap of flexor carpi ulnaris is known as cubital tunnel. So, sometimes the ulnar nerve may compress into this cubital tunnel, which is actually the area between two heads of flexor carpi ulnaris muscle. Now, then it runs vertically downward and reaches up to the wrist joint. So, here in this diagram, what you are able to appreciate, this is the posterior view of elbow joint and this is the anterior view. Now, in this posterior view, you can see that ulnar nerve is visible here, and here the ulnar nerve shadow is visible behind the medial septum of your arm. Now, here the ulnar nerve is not visible because it lies behind the medial epicondyle. That is why you can see the nerve here, because we are seeing this as a posterior view. Now, what will happen, that this is your origin of flexor carpi ulnaris. Now, this flexor carpi ulnaris is having two heads. This is known as humeral head, this is your ulnar head. Now, this gap is known as cubital tunnel. Through this gap, you can see now the nerve is appearing here in the forearm. Clear? So, what is the question? How ulnar nerve enters into the forearm? Answer is it passing through this gap, and this gap is a gap between the two heads of your flexor carpi ulnaris. And then it runs along the medial border and it reaches to the wrist joint. Clear? Now, in the forearm, this nerve ultimately lies between the two muscles. So, on the medial side, what are the name of the two muscle of the front of forearm? First, we are reading is flexor carpi ulnaris, and second is flexor digitorum profundus muscle. So, here in this diagram, you can see that this is your ulnar nerve, and this nerve is going downward vertically, and here you have the medially placed flexor carpi ulnaris, and just next to this, you are having the origin from the ulna, and this major muscle which is arising from ulna is flexor digitorum profundus. So, in the lower part, what you are able to see, that in lower part of the forearm, this ulnar nerve lies between the tendons of flexor digitorum profundus, and this is flexor carpi ulnaris tendon. Now, in distal part of the forearm, now this is become the question of your exam. What are the relations in the lower part, or you can say distal part or lower 1/3 of the forearm? So when you will see the distal or lower one third of the forearm near the wrist, it lies lateral to the tendon of flexor carpi ulnaris, but immediately medial to the ulnar artery. Now this is very important question for your exam about the relation of ulnar nerve. So here in this diagram, you can see that this green color circle is representing a sesamoid bone which develops in the tendon of flexor carpi ulnaris, which is known as pisiform. So this is the pisiform bone, and in this pisiform you are having this white color tendon, and this tendon is actually the tendon of flexor carpi ulnaris. Now this is the most medial part of the your lower forearm. Now next to this you can see that this is your yellow color ulnar nerve, and next to this yellow color ulnar nerve, this is your red color ulnar artery. So what is the relation of nerve and artery? You will realize that nerve is medially, artery is laterally, and both of them lies just lateral to the flexor carpi ulnaris. So this is the question of your exam, that what is the relation of flexor carpi ulnaris, ulnar nerve and ulnar artery in lower part of the forearm. So you have to remember that most medially is the tendon, then you will have nerve, and then you will have ulnar artery. Both of the ulnar artery and the ulnar nerve enters the hand by passing superficial to the flexor retinaculum, immediately lateral to the pisiform bone. So here you can see that this white color band is your flexor retinaculum, and you know that below the retinaculum you have the carpal tunnel. Through this tunnel the median nerve will enters along with the long flexor tendons. But now here you can see these structures are superficial to this white band. So this is very important concept to understand, that carpal tunnel syndrome does not affect the ulnar nerve because ulnar nerve lies outside the tunnel. Clear? Now this is again the question for your exam. Whenever you are having the surface marking, you have to identify the tendon on the front of your wrist joint. So when you will make a tight fist, when you will make a very tight fist, you can see that this tendon is become prominent, and this most prominent tendon on your anterior part of the wrist, or you can say lower forearm, and this is your tendon of palmaris longus. So first you have to identify the tendon of palmaris longus. So when you will do this type of the tight fist, you can feel a very prominent tendon, and this is the tendon of palmaris longus. Now when you will see on the ulnar side, you will have the tendon of flexor carpi ulnaris towards your little finger. So here this is my tendon of flexor carpi ulnaris. Here you have the tendon of flexor carpi radialis. Now if I am saying where is the ulnar nerve, so you have to first identify this tendon of flexor carpi ulnaris, and you will find the ulnar nerve just next to this tendon, because we have seen that there are three structures from medially. Now medial most is the tendon, then nerve, and then artery, and this is your pisiform bone. So when you will see this type of the tendon arrangement, you can palpate your pisiform bone, and just pisiform bone you can trace the tendon of flexor carpi ulnaris, and next to the flexor carpi ulnaris I can compress or feel the pulsation of ulnar artery, and now lies between the artery and tendon. Clear? Now what next is that what will happen in the palm? Now when ulnar nerve enters into the palm, it terminates into the two branches, and when it enters into the palm, it passes beneath a very small muscle which is known as palmaris brevis. So it lies outside the carpal tunnel, and it when reached distal to the retinaculum, it passes beneath this muscle, and this small muscle is known as palmaris brevis, and deep to this muscle it divides into the two branches. So if you will remove this palmaris brevis, you can see that there are two branches. This is known as superficial branch of ulnar nerve, and this is known as deep branch of ulnar nerve. The deep branch is muscular branch and superficial branch is mainly the sensory branch. So in this way you have seen the course of the ulnar nerve. Now we will see the branches of ulnar nerve. So what are the branches in your axilla, arm, forearm and hand? There is no branch in the axilla and arm, which I already told you that the branches starts in the forearm and the muscles of the arm mainly supplied by musculocutaneous nerve. So what are the branches in the forearm? So first is the muscular branches. Now muscular branches arises near the elbow joint, and you know that majorly the muscles of the forearm supplied by median nerve except 1 and half. Now what are these 1 and half? The one is your flexor carpi ulnaris and half is your medial part of flexor digitorum profundus, which is going to control your middle and ring finger. Then you will have the articular branches, and these articular branches are going to supply elbow joint. And lastly, it is having the two cutaneous branches in the forearm. But these two cutaneous branches in the forearm are not arising in upper part, they are arising in the lower part, and these are known as palmar cutaneous branch and dorsal cutaneous branch. Now in this diagram you can see that this is the whole ulnar nerve, and the ulnar nerve is supplying here to this flexor carpi ulnaris, and some of the branches is supplying to the flexor digitorum profundus. Now when you will see the branches in the forearm, I told you in the lower part it gives two cutaneous branch. Now in this spatial image you can see that this is your main trunk of ulnar nerve. Now this is your shadow of the bones of your wrist and the palm. Now this is your ventral aspect where you can see this is your one cutaneous branch and this is another cutaneous branch. Now these cutaneous branches are supplying the adjacent side of your palmar area. So this is your superficial branch and this is your dorsal branch of ulnar nerve. So when you will see the branches of ulnar nerve, there is a palmar cutaneous branch, another is dorsal cutaneous branch, and palmar cutaneous branch arises proximal to the flexor retinaculum and it supply skin of your hypothenar eminence. Clear? So where is the hypothenar eminence? This area on the base of your little finger is known as hypothenar area. Now the dorsal cutaneous branch arises from the ulnar nerve 5 cm above the wrist. But the important thing is that this nerve has to go dorsally. The nerve will passes posteriorly or dorsally, for that it pierces the deep fascia and then it appears on the medial side of the dorsum of hand. So it appears on the medial side of the dorsum of hand and it supplies the dorsal aspect of the medial 1 and half finger. Now this is again important thing, that it supply only medial 1 and half. So this nerve, this ulnar nerve which we are talking about is having the two cutaneous branches, and both the cutaneous branch arises in the lower part of the forearm. Clear? So this should be very clear in your mind, that in this diagram also you can appreciate that this is the dorsal branch and this is the superficial branch of your ulnar nerve, which is cutaneous in nature. And these branches are arising in the lower part of the forearm. So though they are supplying your hand, but they are arising in the lower forearm. Clear? Now what are the areas or the branches in the hand? So I told you that in the hand it terminates into the two branches, superficial branch and deep branch. Now the superficial branch is mainly sensory in nature and only muscle supplied is palmaris brevis. The major branch of superficial branch of the ulnar nerve are digital branches. So what are the digital branches? Medially it will give a palmar digital branch and laterally it will give a common digital branch. Now here you can see in this diagram that this is your superficial branch, this superficial branch is giving a small branch to the palmaris brevis. Then it is giving two branches. This is your branch which is going to supply the ulnar border of your little finger. While this is the common digital branch, and this common digital will bifurcate. And once it will bifurcate, it will supply adjacent side of your little finger and your index finger and your ring finger. Clear? So, there is a one common digital branch, and that common digital will bifurcate to supply the adjacent side of your ring finger and the little finger. Apart from that, you have one branch which will supply the medial side or the medial border of your little finger. Now, what about the deep branch of ulnar nerve? Now, the deep branch of the ulnar nerve is mainly motor or mainly muscular, and deep branch of ulnar nerve supply the intrinsic muscles of your hand. So, in the initial I told you that the intrinsic muscles, except the few of them which are supplied by the median nerve, majorly supplied by the ulnar nerve. That is why the ulnar nerve is known as musician nerve, because it controls the fine movements of the finger. So, this deep branch, now it is known as deep branch because when you will see the course of this branch, it is taking origin deep to the palmaris brevis, then it is making a arch, and if you will see this arch lies on the deeper plane in the palm, and it lies deep to the long flexor tendons. So, here you can see that these are the long flexor tendons, and the deep branches lies deep to the long flexor tendon. So, when you are having the name like superficial branch and deep branch, you have to understand the meaning of these words. The branch which is superficially placed is superficial, and branch which will go deep to these long flexor tendons is known as deep branch of your ulnar nerve. So, the deep branch of ulnar nerve passes within along with the deep branch of ulnar artery, and it penetrates to supply first hypothenar muscles, then it reach on the deep aspect of the palm, then it arches laterally. From medial to lateral, it make a arch across the palm, and across the palm here it lies deep to the long flexor tendons of the digits, and ultimately it will supply the interosseous and adductor pollicis muscle with the two medial lumbricals. In addition, the deep branch of the ulnar nerve also give articular branches which supply the small joints of the hand and the wrist joint. So, in nutshell, if I will tell you, name the muscles supplied by your ulnar nerve in hand. So, in hand, you have to remember it supply the hypothenar muscles, that means flexor digiti minimi, abductor digiti minimi, opponens digiti minimi. It supply the all palmar and dorsal interosseous. It supply the medial lumbricals, that is the third and fourth lumbrical, and it supply adductor pollicis. Remaining thenar muscles and the two lumbricals supplied by median nerve. Clear? So, suppose you have this picture in exam, identify the branches of ulnar nerve. So, this should be very easy to identify, that you have to first mark this bone. Now, this bone is your pisiform bone, and this is your hook of Hammett. Now, here you can see that this nerve lies in very close proximity of this pisiform bone. So, this is the main trunk of ulnar nerve, and then it will immediately divide into the deep branch, and this is the superficial branch. So, this is the superficial branch of the ulnar nerve, this is the deep branch of ulnar nerve. Now, this is your cutaneous branch, this is palmar cutaneous branch, and this is dorsal cutaneous branch of ulnar nerve. The deep branch is making an arch, and this arch lies deep to the long flexor tendons of your wrist, where you have the flexor profundus, flexor digitorum profundus, and flexor digitorum superficialis tendon. Now, there is one more important applied aspect, is known as Guyon's canal. Now, what is this Guyon's canal? Now, this canal is nothing but there is a ligament, or there is a covering of ulnar nerve and that covering lies outside the flexor retinaculum. What does it mean? That this is your flexor retinaculum and this is your carpal tunnel. Now on the medial side, you are having the ulnar nerve, which is superficial to the retinaculum. But there is one more covering of a ligament, that is the ligament of wrist joint, and there is a separate tunnel is formed near the wrist joint, and this separate tunnel is known as Guyon's canal. So what is Guyon's canal? That the ulnar nerve at the wrist course between the pisiform bone and the humerus of the hamate bone, and a ligament which lies superficial to this site creates a fibro-osseous tunnel, and that is known as Guyon's canal. So this ligament is a connection. This ligament is a connection between the pisiform and hook of hamate. So here you can see that this is the hook of hamate, this is the pisiform, and in between there is a connection, and this connection is making a additional canal is known as Guyon's canal. So sometimes there is a compression occurs of the ulnar nerve in this canal, maybe due to the bulging of synovial membrane or a ganglia is formed inside this canal, and that will lead to the features of ulnar nerve involvement. So this is what about the ulnar nerve. Now I hope you know what is the course of ulnar nerve, why the C7 root is a part of the ulnar nerve, how it comes there, what are the branches of ulnar nerve, and what is the cubital tunnel and Guyon's canal in relation to the ulnar nerve. So this is all for today's class. Thank you.